How important is a primary care physician? It's extremely important because they are basically the gatekeepers to keep you healthy, keep you going, and make sure everything's dialed in with your nutrition, your medication, and any specialists you may require and or need. Hi everybody, I'm Caregiver Cookie. And on today's segment, I would like to talk about primary care physicians, also abbreviated as PCP. Now, a primary care physician is basically not just your main physician, but it's also someone you trust, a confidant, someone you can talk about very personal subjects, right? Whether it's your health, anything that's going on at home. As a caregiver, any stresses you're dealing with, they're almost like a psychologist. Really, they're a therapist, a best friend. That's how I see a really good primary care physician. My mother, myself, and my gentleman I take care of, we've all been very blessed with having really solid primary care physicians. And they can also be NPs, which is a nurse practitioner, a PA, which is a physician's assistant. A PA and an NP are basically very similar. They can both diagnose, they can administer medications. Sometimes they oversight from an MD or a DO. But for the most part, they do have free range, and there are a lot of wonderful PAs and NPs out there. But with your primary care physician talking an umbrella, encompassing everything as a whole, they basically will make sure that all your medications that you're getting, you're receiving as needed, not over-medicating. As well, they're also, as I mentioned, a gatekeeper to get you to any specialists. Perhaps you have an arrhythmia, you have a heart murmur, anything going on cardio-wise, they'll send you to a cardiologist. If you're dealing with neuropathy, pain in your feet, headaches, migraines, also they can send you to a neurologist. If you're dealing with, they need help navigating your type 2 diabetes, because there's a lot of us out there with type 2 diabetes, they can send you also to a different specialist as well. But basically, they will send you to the needed, I'm sorry, I was going to mention endocrinologist. I got lost there, senior moment, my bad. But yeah, endocrinology, which is basically the treatment of type 2 diabetes, thyroid issues, metabolism. We have a wonderful endocrinologist, but to get that endocrinologist, my mother's amazing PA guided her to this amazing endocrinologist who has taught me so much vast information because I'm always asking her questions. And she's like a wonderful professor. You know, I'll give you an example, right, of my mother's endocrinologist. And then I'll get back to my mom's PA and her family general physician as well. But the endocrinologist, I can sit there and talk to her about dosages on the insulin, knowing how much to give, nutrition. She's very well versed in nutrition and the importance of, you know, not just counting macros and your carbohydrates, but just basically knowing your body and what your requirements may be. Getting back to my mom's PCP, primary care physician, she has couple of wonderful PAs, one in particular I just think the world of. And her physician, the MD, and the DO are both fabulous. I can't say enough about them. But over the years, what they've done with mom is basically navigate and guided her to the specialist they have good rapport, good relationships with, right? Now let's go back. Let's say you have a primary care physician you're not pleased with. Perhaps they're not listening to you. You're just a number. Folks, this happens. Just like you have wonderful educators and teachers, great judges, police officers, firemen, accountants, on and on, mayor, city council. I mean, we could list a vast array of different sectors. Everybody is either going to be passionate about what they're doing or they're not. And for your health, which is your well-being, which is the longevity of your life and your quality of life, you want to make sure your primary care physician is in tune with you and your needs. You can sit down with them. They can discuss things. They're not trying to shoo you out of the room because they're on, you know, time is money and they got to get on to the next patient. No, they, you know, I realize all primary care physicians, family practitioners, they're swamped, but you still make the time for your patients always. You know, let's say if someone come in, they've been married for 60 years and they lost their significant other recently. A wonderful primary care physician, as what happened with my grandfather, took the time and spent several minutes just listening to him. And that was really big, you know, because, you know, as a primary care physician, they're there for you to make sure everything your needs are in balance. You know, they make sure that you're not taking medications that are not unnecessary medications, which is also important. and making sure you're staying on top of your cholesterol if you're taking a statin, your different blood pressure medications, your insulin, your metformin, which is an oral medication for that, even your GLP-1s, which is for weight loss, which is maybe a Wegovy or Ozempic or Januvia, and so forth. But basically, I can't stress the importance of them. Having a good rapport with them, getting in on a timely manner, where you're not having to wait, 4 weeks when you need to be seen within the next week to 10 days. Also, if they can accommodate and see you virtually, that's fine, because once you see your physician in person, virtually also, you've already got an established relationship. You can have a wonderful conversation over the computer if you have access to the internet and to the technology, and get a lot resolved if you can't make it to their office, or you're a distance away. Also, speaking of distance, make sure your primary care physician are within a decent range. If I live somewhere and I have access to 9 different primary care physicians, for example, within a 5-mile radius, but my insurance network puts me at 135 miles away, that's not helping me any. So unless you're in a situation where you're in a rural area, then I understand. But even then, you do have choices, folks. Always remember that. Pick a primary care physician that listens to you, is there for you, for your well-being, because at the end of the day, whether you're a caregiver, whether you live alone, you have a significant other, you have children, your health and your well-being is really important. Stay healthy, my friend. I'm Caregiver Cookie. If you could give me a like, I'd really appreciate that. And if you can subscribe to my channel, I'd greatly appreciate it. Stay healthy, stay active, stay hydrated, right? Hydrate with water, and take care of yourselves. See you soon. Bye.